Hey, it's Bram Duffee for Health Communication class. This week we're talking about mental health illness in health comm. You know, mental health is a topic of big time importance, and at the same time, it's often overlooked or misunderstood. And the statistics regarding mental health in America and the world are really staggering. According to data from sources like the National Institute of Mental Health, and also I got stuff from the Centers for Disease Control and Johns Hopkins Medicine, about 1 in 5 Americans suffer from a mental illness. And this means that about 20% of the population is battling from some kind of mental health issue. And what's even more concerning is that about 60% of these people don't have any real treatment or medication that they're taking. And so in 2019, 47 million adults were dealing with a mental health illness, but only 43% received any kind of mental health care. So this lack of treatment can have really bad consequences. More than 40,000 Americans die annually from suicide, and that makes it the 10th leading cause of death in the United States. The prevalence of mental health issues is really high among adolescents and young adults, and the rates sometimes reach 50% for adolescents and 30% sometimes for young adults. And anxiety disorders are the most reported mental health issue in the U.S., affecting about 42 million Americans. And then women experience depression about twice the rate of men. All this further highlights this gender disparity that's out there for mental health. The economic impact of mental health is also significant. You know, serious mental illness costs the country $190 million in lost earnings every year. And 26% of Americans who are age 18 and older suffer from a diagnosable mental disorder. And almost half are going to experience a mental illness in their lives. When we talk about children's health, there are a lot of kids that are living with anxiety and also problems like behavior issues, ADHD, and depression. These are some of the more common things that are affecting our kids today. And on a global scale, the numbers are also pretty rough. And it's not just a problem that is United States based alone. When we think about mental health, I have to also, of course, mention the landscape of the mental health that's in colleges. Over 25% of college students have been diagnosed or treated by a professional for a mental illness, and about 64% of students stop pursuing their education because of something like that. There's a lot of college students who seek help for mental health concerns, but 34% of students with a mental health condition said their college didn't know about their crisis. And that's concerning because most college counselors, want to be helpful and have resources available. Mental health is a really pressing issue that needs attention, and there are a lot of mental health issues they're common that I'd like to review, and not just from a clinical aspect, but also a societal aspect to think about these. I know that this lecture seems all doom and gloom, but what we can take from this is we can take the principles that we've looked at with it when it comes to health communication and work to figure out how to best help these people. And some of the folks require some stigma relief. Some stigma could be changed, or some others could benefit from funding or opportunity, or there's a lot of things that can help these folks. I have to say that my own experiences as a paramedic, I've had numerous situations where I interact with people that have a mental illness, and these folks, especially on the street, that I encounter that are homeless are there in that mental health space because they're wrestling with challenges that mean that they are confronting societal norms. Like they can't do the things that society requires of them. And though that structure that they have to live in is usually pushed away by mental health issues. So if we take schizophrenia, it's difficult for someone with schizophrenia to interact and maintain normalcy when they are hearing voices. With bipolarism, it's really difficult to maintain the normal interactions with folks when you have these wild swings in behavior and impulse. And so the same thing happens with substance abuse. You know, there's a time when substance abuse, whether it be methamphetamine to alcohol or anything in the middle, can be so bad that you're not able to conform with your requirements of your roommates or your family, or even the people that love you can't take it. And so that's how folks end up in these homeless situations. And so it's not just as easy as giving people money to fix the problem. Usually there are homeless connectedness to mental health. And so my view of my view of homelessness is that the key to that is mental health. The other topic that gets brought up a lot when we talk about mental health, when we talk about homelessness, and is the veteran population. And you might say, well, how does that have anything to do with mental health? We're talking about veterans. Well, just like we have substance abuse and just like we have mental disorders, we also have people who've gone through horrific mental changing moments, right? Where they've had lots of experiences that were super bad enough to give them the PTSD. So you can imagine that PTSD can actually be so incredibly bad that they are not able to live with society. So these are all considerations for what's going on with the homeless population. And this is why your assignment is about this topic this week, because I want to invite you to open the idea box on what we can do better for these folks when it comes to health communication and mental health. You know, one of the pivotal moments in history with mental health happened when the JFK presidential administration brought about changes in how we do psychiatric treatment. And this psych treatment change meant that they closed a lot of the long-term psych hospitals across the country. A lot of times they were state funded, but the fallout from this meant that patients who were once occupied these institutions were now integrated to society. And so a lot of these people began cycling in and out of the short-term psychiatric treatment facilities. Short-term meaning like 3 days, 7 days. So today we have a system in the United States that's broken. And this broken system looks something like this. Most emergency departments have 25 to 50% of their population with psych patients. And if you think about that as a percentage of people in the emergency room that's your patient, it's a big demand. So 20 to 50% of your patients have to be watched and have to be cared for in a particular way so that you're protecting them from themselves. And so that's where a lot of these folks get trapped. And so the reason why they stay there for hours and days is because it takes time to get them admitted and transferred into mental health facilities. And the reason is that these mental health facilities are not that numerous and they are overburdened. So it's a system that's backed up, and that system that's backed up ends up with vulnerable people in the emergency room. And so the emergency room is not a place to take care of homeless psych patients. It's supposed to be a place that is to take care of people who are near death, and receiving that life-saving care. So let's talk about just some of these common mental illnesses. And I just want to share some of these with you so that we can have a more well-rounded understanding and explanation of some of these things. Because some things that you may have heard of in passing, the terms for them, and other things you may have deeper familiarity with. But either way, it's worthwhile to discuss. And so the first one is an anxiety disorder. This is the most common type of mental illness, and people with anxiety disorders respond to certain things or situations with fear and dread, and also have physical signs of anxiety or panic sometimes, like rapid heartbeat or sweating. So the physical signs, can come with that. Major depression is different. Major depression is a mood disorder that's characterized by this persistent feeling of hopelessness and sadness and loss of interest in activities. This is something that affects how you feel and how you think and behave. It can lead to a variety of emotional and physical problems. So major depression is a big deal, as you can imagine. Another one to mention is bipolar disorder. This is also known as manic depressive illness, and it causes really wide shifts in mood and energy and activity levels, and even the ability to do day-to-day tasks. So you can imagine manic would be just an extreme positivity and mood, and then that mood could change all the way from that manic episode to a very sad, down, hopeless period or depressive episode. So that would be bipolar disorder. Schizophrenia is one that I mentioned, and schizophrenia is a serious mental disorder that affects how a person thinks and feels, and also how they behave, because people with schizophrenia may seem like they've lost touch with reality, and that can be really distressing for them and those around them. A lot of times schizophrenia comes on when you're young, like your teenage years, so into puberty. And it's common for people to hear voices and have these voices be intrusive thoughts, and can even sound different and be visual. So you can hear things and see things, hear people and see things. And so it's very distressing. The other one to mention, I'm sure that you've heard of, is pretty commonly discussed anyway. It's called PTSD, it's post-traumatic stress disorder. This is a disorder that develops in some people who have experienced really shocking, scary, or dangerous events. And some of the symptoms might include flashbacks or nightmares or severe anxiety. The other thing would be to have uncontrollable thoughts about the event. So post-traumatic stress disorder is something that is not easily fixed, and it's almost as if it's a wound that happens, a mental wound that happens to someone. Obsessive compulsive disorder, OCD, I think that's another one that's commonly talked about or heard about. People with OCD may have symptoms that really are centered in on obsessions or compulsions. And these symptoms can interfere with all aspects of life. And I think that OCD can mean repeating things, whether it be numbers or statements, or it can be repeating, double checking that things got done. And these things are done to alleviate anxiety, but at the same time you're showing off anxiety. So this is a severely debilitating illness for some people. Also, eating disorders fall into the realm of psych care. And to mention, of course, are bulimia and anorexia. And These kinds of disorders involve extreme emotions and attitudes about weight loss and food issues, and they can have life-threatening consequences. So that when we talk about anorexia or bulimia, we're talking about vomiting the food that you eat out of shame, and or we're talking about eating an unbelievable restrictive healthy diet with an obsessive amount of exercise. So we're talking about these kinds of the spectrum issues. Another one that you might be familiar with is attention deficit disorder, ADHD, attention deficit with hyperactivity, or it could be without hyperactivity. It's the most common neurodevelopmental disorder found in childhood, and it's first diagnosed usually in childhood, and it lasts into adulthood. People who go through puberty and are usually have improved symptoms. So what that means is that sometimes when you're a child and you take medicine for this, you don't have to have it later as an adult. But people with ADHD have trouble paying attention and controlling impulsive behaviors, and might be overly active. So it's about impulse control. Another one that you might be really familiar with is autism. And autism refers to a broad range of conditions that are shown off by challenges with social skills and repetitive behaviors and nonverbal communication. But each person with autism has a distinct set of strengths and challenges. And the folks who are at the most extreme level of autism have a difficulty with processing sensory things. And so that means taking in too much information through touch or sight or seeing can cause them to be overwhelmed. And so things like when we say touch, things like texture or that food texture or feeling texture can cause extreme feelings in a person like that, one way or the other. Same thing would be, if you can imagine, having to take in too much stimuli at once can be overwhelming for a person like that. And so because of that, we commonly see folks that might wear a hoodie or might wear ear muffs or earplugs so that they can limit their the information that they're taking in. And what I've done, by talking about autism and OCD and ADHD and depression, is I've just given a basic idea about each disorder, because it's important to remember that mental health is complex and it's multifaceted. And so we don't want to put fast, easy, quick labels on things when we know that they require much more consideration. And so through this talk, I hope that we've been able to just explore some more that the psych world has to offer, so that now we can begin to think about these social issues in a new way, and in particular this week, looking at and exploring homelessness. So until next week, I look forward to reading your stuff.